you so much for joining my channel again. For those of you who don't know who I am, my name is Sue Lady, also known as Sue Lady VSG on all social media platforms like Instagram and here on YouTube. I just want to thank you guys for joining me today, and I want to introduce to you none other than the golden boy himself, Dr. Galindo. And he is here, one of the surgeons at Pompeii Surgical in Tijuana, Mexico, and he is a bariatric surgeon. So I want to first thank you so much for joining me today. I really appreciate you taking the time out of your day to interview and really allow everyone to get to know you on a more personal level. Bigger demographic of patients are coming from the US, right? And so a lot of people don't really get to meet the doctors and really talk to them and get to know them. And so I really appreciate your time, because I know the time is something you can't buy, and I really, really appreciate that. What I'm gonna do now is I'm gonna give Dr. Galindo, the golden boy himself, an opportunity just to kind of address you guys and give a little opening statement, if you will, if you don't mind.
Yeah, well, I mean,
You've got the floor.
thank you. Let's dance, right?
Yeah.
Well, now
I
can try. I can honestly try.
The floor is yours.
Thank you for inviting me, and also like helping answering the questions, and for the patients that are thinking of coming to us or already done the procedure and they forgot to ask the questions or are already here, right? But it's a nice time to have you here.
Oh, thank you.
Thank you for inviting me.
I'm so happy that you're here. And again, you know, as far as me coming, just for those of you who don't know why I'm here, my boyfriend Chris is having VSG with Dr. Salcedo, the doctor who did my surgery, and he just actually had his surgery today. And Dr. Galindo and the other surgeons have been nice enough to be able to sit down and talk to me. So trust me, the pleasure is all mine. Trust me. So I'm gonna ask you a couple questions and kind of just have a little conversation so our viewers can get to know you a little better. Is that okay?
That's perfect.
Fabulous. All right, so we're gonna get right into the question section. First, I just want to start off with kind of getting to know you a little bit better, because I know a lot of people ask a lot of questions. And so, if you don't mind, I'm going to start off with the first question.
Yes, please.
Okay.
Let's hear it.
A little more insight on Dr. Galindo and how you decided to become a bariatric. Why bariatric surgery? What made you want to become a doctor and a surgeon?
Well, I mean, as long as I can remember, and I'm talking a little boy, right, a child, I always wanted to play a doctor or in the TVs. It used to be long ago that a show called ER.
Oh yeah.
Okay.
That's a good one, George Clooney.
Yes.
Ah,
yeah.
Yes.
And
He's
I
my golden
don't know
boy.
why. Well, that was a pediatrician, but well.
So.
And I don't know. I always wanted, but it was really a desire that I wanted to become a doctor, right? Now the surgical part, because there's a lot of things or a lot of fields during the medical specialties. I don't know why, but I always wanted to become a surgeon. I would not have been complete if I wasn't a surgeon.
Yeah.
So that's where it all started, right? The surgery has to be precise, specific, and there are no second chances. That's what I like, right? Or I love. Once you cut, that's it.
There's no going back.
There's no going back. There's no, I think, no. So it's a specified field. So I think that's why I became a surgeon. In bariatric surgeries or procedures, it's something that we have to learn also. It's a surgery that you will see a life change. At the end of the day, right, the best part, I would say, it's when you get to the patient, that beautiful word that they say, thank you. That is gonna be the most sincere, and with the heart in their hands, say thank you for helping me. Thank you for helping me get my life back, for changing my life. But I mean, it's something that we are a team,
Yeah.
right?
Yeah.
I do
It's
our,
a relationship.
yeah, that's it. That's a word I would use. We are a couple
Yeah.
now, right?
Absolutely.
So I have a lot of couples now. But I mean, that's the way I think it should be.
Yeah, absolutely.
Right.
It's wonderful, that gratitude that you feel, that the heartfelt emotion coming from your patient, that you have done something for them that they can forever be grateful to you for. And that's a feeling that I'm sure is amazing.
It is amazing.
It's worth everything, isn't it?
Yes.
That's
it was.
amazing. The question of the hour. How? Everyone wants to know. How did you get the name Golden Boy?
The golden.
El Niño de Oro.
El niño de oro. I mean, it's not that. I know probably you will want to hear a big, like a movie type, but no, it's not. It's very simple. I was in the final talks with the company's top, right, with Mel and Case and everything. So as soon as I step inside and okay, we will work together.
Or with Pompeii.
With Pompeii, yeah, of course. Melanie just said, yeah, the golden boy's here, so that's it.
I told him he was the last golden boy.
Yeah, the last golden boy. And she started to introduce myself. Yeah, meet the golden boy. Oh, meet the golden boy.
Oh.
And that's it.
So
and
it
it's
was
it.
Melanie.
Yeah.
Let's make sure
Yes,
that we
ma'am.
give her the credit. So, if y'all don't know, now you know.
Yeah, I mean,
Melanie, who is one of the executives on the business side of the team that runs Pompeii, she was the one who gave him the Golden Boy title when he finally signed that dotted line, and just happened to call him, one of the last Golden Boys are here, and started introducing him as such, and kind of stuck. It's like a nickname,
Oh, yeah.
guys.
What made it so funny is how much he embraced it.
Yeah.
Because he would show up and he would have his little golden boy T-shirt on, but then the patients picked it up, and that's when it became the inside joke.
Yeah.
Because the patients expect this big, like, oh, this must mean
Yeah.
something fantastic.
Yeah.
It was literally just a side comment, this stuff.
So that's where it came from, guys. You heard it right from the lion's mouth. Okay? The Golden Boy, El Niño de Oro,
El niño de oro. I mean,
in the flesh. It was Melanie.
I gotta
She
live up to it now.
Yeah, she happened to call him that when he signed the dotted line to join Pompeii, and it just kind of stuck. And his patience has carried it on, until now. So that is where he got his name, the Golden Boy. There you have it. Next question. All right, so let's talk more into just all about bariatric surgery. Let's get into the meat and potatoes, the steak of it all. For whoever's on the 2-week liquid diet, I'm sorry, the broth of it all. I know I got mom jokes. All right, so I asked the people on the private Facebook Pompeii support group just to ask me a bunch of questions, and if you ask, y'all shall receive. So without further ado, I will be giving a couple questions that you guys gave me. I also took a couple questions off the YouTube channel and also off my Instagram. So this is just a little compilation of questions that a lot of people ask often. All right, so question numero uno.
We'll do it.
When they cut the fat away from the stomach while they're taking the part of the stomach out, why is it that they don't take some of the fat out while they're in there? Some people want to know, why don't you nip and tuck me while we're in there?
Yeah, I mean,
Why only just the stomach?
that's.
By the way, this question was from Diana.
Diana. Well, I think that's most of the common questions that I would get every day, right? Since you're there, why don't you take a little bit out? But unfortunately, it has a lot of big important vessels there, blood vessels, and it's not even necessary. because when the patient starts losing the weight, it happens so fast that that momentum, that's the word, that fatty tissue that you call, it will be less and less. It's gonna be thinner, because the body will do his part, and it's gonna go away. But also, that's the same thing that will happen with the liver.
Yeah.
Right. So.
Yeah, people. So this is not plastic surgery.
It's not.
They're not doing lipo. It's bariatric weight loss surgery. So unfortunately, the only thing that comes out is a piece of tummy for the VSG surgery. So that answers your question, Diana. I hope it answered it well. Next question: what type of sutures and staples are used during the surgery initially? Diana Whitby asked that.
Okay, well, Diana would be.
Again, there's a lot of Dianas.
Now the staples are titanium, right? That's the material that they're made, and each staple has 6 lines, 3 and 3. 3 get with the piece that we take out, and 3 stays with the sleeve, right? Yeah.
Mm-hmm.
So they will interlock with each other, so it makes a seal, right? So after that comes the reinforcement of the staple lines. That is done with a probably make it more secure, less bleeding, and it's something that it has always been. The safer, the better.
Absolutely.
Right. So
the more reinforcement, the better.
Yeah, I mean,
Perfect.
the most important thing is always the safety of the patient.
Absolutely.
That's
That's
it.
paramount.
Yeah.
Awesome. All right, so let's see the next question. All right, so for the stitches to close the 4 little incisions, right?
Maybe 5.
Why not use dissolvable stitches so they don't have to be removed at home? Anthony asks.
Okay. There's a really good question. It's a good question. Every question is gonna be good, right? But this is an important one because Anthony, right?
Yep.
Anthony. Every incision that we take, they're gonna be really small, and the bigger one's gonna be to 1 centimeter. That it's not that big, right? Now, the fatty tissue of the abdomen sometimes is bigger than that. So, for the trocars to get in, the pieces that we take out, what it can happen is they can develop seroma. It's a fatty tissue, but it will form like a capsule of that oil, right? So if we closed it with a subdermic suture that you don't have to take the stitch out, it can be worse when you're back at home and develop the big cyst or even an abscess just for that.
Yeah, so that's not good.
Right? No, that's not good. Like I said before, it can happen and it cannot, but we always try to play the safe road better.
Gotcha.
Okay?
All right, that makes sense.
Yes.
So basically, it's just a safer way to avoid possible.
Yes, because if the fatty tissue will accumulate that, it's easier to get out.
Yeah.
Than if you develop it and they are closed in, you're gonna have to go inside in surgery.
Okay.
So yes.
Gotcha. There you have it. Ain't no dissolvable stitches over here. All right, so let's see here. Next question is from Marisol. Have you ever lost anyone on the table?
No. Knock on wood.
We just got
Never. So I'm planning to do that and continue on with that. So no, thank God no.
Wonderful. All right, let's see here. Veronica, do you recommend removing your gallbladder during surgery to avoid any complications later?
No. Well, if the gallbladder doesn't have issues, no. You cannot, because like I said, it is a surgery, right? So we're not gonna take a risk that is not even necessary, and also just in case that I get the stones in the near future, probably you don't even develop them, right?
Yeah.
So no.
Unless it's a dire necessity.
Yes.
Okay.
And also it's illegal, right?
Yeah.
Yeah, we cannot do that.
Yeah. You can't take a gallbladder out because you want to.
Yeah, no.
Just,
It's a organ, so.
Yeah, they don't do that. Only if it's completely life-threatening, right, and necessary.
And also, another important reason is because since it's a surgery, you will put on risk the first surgery,
Which
right?
is your bariatric
Yes,
surgery.
that's the way it should be, and you don't have any reason for take the gallbladder out if it's not necessary, because let's say that the clip that we put on the cyst pops. It's gonna see. Yeah, I mean,
it's over.
It's something that we shouldn't do, right?
Yeah.
Put a patient in a riskier situation just because.
Yeah, more anesthesia, more
Everything.
time under.
Yeah, because it's two surgeries.
Yeah, absolutely. That makes a lot of sense. All right, so our next question. Okay, this is a personal, funny question.
Okay.
But a lot of women want to know. It's nothing to do with surgery, but I'm going to ask it anyway. Mrs. Heather, this is for you, Heather. 1,000 ladies would like to know: are you single or married? I just thought it was a fun question.
Okay, I get blush, right?
Ladies,
I am married.
you put a ring on
I
it.
am married. Yeah, I'm married. Yeah, what can I say? I'm married.
Happily married.
Happily
yes.
married. That's the way that I
Keep your calls to
wife.
yourself.
I was gonna say that.
The wife, you're okay. Don't worry, I got you.
No.
No. So the next question is from Roseanne. Is there a way to know if you stretch your new stomach?
I mean, the patients always will know how much they're starting to eat, right? They can stretch it, yes, they can. But it takes time. It's not something that's gonna happen over a month.
Yeah.
But it can happen, yes. Now, how do they know that? It's because they will notice that they start the intake a bit more. They start getting hungry faster, or they're not getting full like they used to, right? But if the patient is disciplined, like they should, I mean, no, it won't happen, right?
What do you think? And I know that this, and I'm gonna actually ask my own question, given the fact that I had bariatric weight loss surgery a year and 4 months ago, and I've personally lost 170 or over 170 pounds in that time frame. I know that for everyone, the amount of food that you can intake is going to be different. Everyone should not think that everyone can only have 4 ounces or 8 ounces. Or everyone is different, correct?
Every patient is going to be different.
Custom for everyone.
Yes.
Because that was a question that I get a lot.
No, they say, why her is getting full with less? And I mean, it's first of all our digestive system from here all the way down, it's gonna be a muscle.
Yeah.
So it will have that, it's a property of expanding or stretching, right? It's not something that we can.
Yeah, nobody can answer.
No.
All right, let's see here. From Roseanne, is there a way to know if you stretched your new tummy?
Okay, I mean there is, right? You have to do like a procedure that is like barium salt, right? Or the leak test. Yes, that's the one.
That nasty test that we did that tastes like iodine or alcohol. It's disgusting. I don't recommend it, but we have to. That's the only way you're gonna find out, though.
Yeah. Also, an important thing here we should like point out, it's the habits of the eating, right? That's a part that is more important than even the barium salt, because if you continue to eat like you shouldn't, and just throughout the day, picking here, picking there, you will say or notice that, oh, I'm eating more and I'm eating a lot more than I used to. But that's not because you stretch your sleeve or your procedure, right? It's because your habits are not, and you are not being disciplined. That's the most important thing that I would say.
Yeah, that makes sense. I'm gonna give you guys a little bit of insight as to how what I do as far as my eating habit. I'm not gonna go too much into detail because you guys can see other videos that I posted as to how I eat. But what he's saying is absolutely right. In my experience over the last year and 4 months, I tend to not do the 3 square meals a day. We don't have the regular stomach everybody else has. We can't fit a whole full meal. However, we should still have the nutrients in our bodies like a full meal. So what I typically do is, let's say breakfast. I have a typical size breakfast for any regular stomach, but I cut it in half. I have one part of it, then I wait which is about 3 to 4 ounces or so, and then I wait another 2 or 3 hours, let that digest go down, and then have the rest of it, which is another 2 to 4 ounces, which makes you 6 to 8 ounces in a meal, but cut up into 2 portions. So at the end of the day, I'm having about 6 small portions, but still having the macronutrients that I need to sustain myself properly and be able to have the nutrients that my body needs to survive properly, and also jumpstart that metabolism and have that weight loss effectively and efficiently. Does that make sense?
Yes, it does.
Okay. So the next question I have here is, so Kristen asked, have any of the surgeons, have you ever had weight loss surgery?
No, not yet.
Maybe after a couple kids.
Yeah, well,
The belly.
I gotta go and work out again.
So no, he has not had any weight loss surgery. Kayla asked, what do we need to watch for post-surgery, and how long typically is recovery?
Okay, the most common question that I always hear after surgery now, it's when can I start working out, going to the gym? It's something that they really want to go for it, right? In this type of surgery, you will notice that it's not like it used to be before, that you will wait like a month just to start feeling better or being functionable,
Yeah.
right? No, with this procedure, in a week or a couple of weeks,
Yeah,
you're
you feel
back
like
to normal.
you feel good. Of course, you have that restriction. I'm only gonna chime in because I've had the surgery and I can attest to this.
Uh-huh.
But personally, everyone has a different threshold and everyone has a different experience. So it might be different for everyone. This is not Bible for anyone. However, my particular experience, after I got back home, I was walking around, washing clothes, doing things. Of course, not picking up more than 15 pounds for the first 4 weeks or so, but I was predominantly pretty good in walking around and doing my normal day-to-day activities.
Mm-hmm.
I did take about 2 months off of work, but that was my personal preference. But it really, I would say, like the 2 weeks off would be ideal. But usually, you can be up and running a few days after surgery.
Yeah, I mean, if you really need to just be there, okay, you can start, but just walk.
Yeah.
I mean,
take your time.
it is like we said before, it is a surgery. It's not the small incisions. That doesn't mean that it's not a big procedure, right?
Yeah.
So that's one thing that I will recommend to the post-op patients now. That
Pace yourself.
yes, right. Take your time. There's no rush. Okay.
So basically, pace yourself, take your time, and really listen to your body.
Yeah. Listen to your body, but your body will tell you, I'm feeling great.
Yeah.
So take your time. There's no rush, and everything. Just trust the process.
Mm-hmm.
It's a process, and just trust it, and it will give you more benefits than you could ever think.
Absolutely.
Right? Also, the eating habits are gonna be fundamental. So those are gonna be the things that I would say every post-op patient should look into.
Absolutely.
Or watch for.
Yes. All right. So the next question is, have you ever rejected or denied a patient the surgery once you started? Was there ever a time where you couldn't finish a surgery?
Okay, no, at least not yet, right? It can happen, yes, but no. I've always been able to finish the procedure once I've started. Sometimes it will take a little bit more time, but time it's something that you should not focus on, and you really don't know what time you're starting or
you don't know what's gonna happen when you pop in there.
It's a one-way ticket.
Find a baby or something. You don't know. I'm kidding.
It's only a one-way ticket. So once you go inside, that's it. You get out until you're finished, and that's it. But not yet, like I said.
Now, although you haven't had a particular patient that you couldn't finish the surgery, are there times where there might be circumstances where you might not be able to? If so, can I have a couple of examples of why maybe you might not be able to finish?
Okay.
Or do the surgery?
No, it is, right? It is, sincerely, it's gonna be really common. It haven't happened to me, but that doesn't mean that it doesn't happen, right? First of all, sometimes you can find tumors, right? The additions of the scar tissue that some patients have or develop for any reasons, that are several ones. I think those are gonna be the most common things or reasons for not to finish the
Thank you. All right, so let's see here. This is from Sean or Shay. Sorry if I butchered that. If someone has had a blood clot before, does that change their surgery post-op in any way?
Okay. Yes, I mean it will. It will be different than a patient that doesn't have had, right? But this will be it's a big question because it will have to be more specified. If the clot is on the leg, on the lung, other places, right? But it will. You just have to, if the patient is with blood thinners, okay, we always have to know which ones, how much time they have it, the amount that they're taking it, so we can stop and restart or take the medical medication.
It's very important if you are on a blood thinner to be able to give your surgeon or the medical team that information accurately, because that makes a difference, and they need to know all that information in detail for them to be able to move forward.
Yes.
So it's a very good question, Shay, and it's good that you asked that. Vicky asks, for someone with acid reflux, which surgery would you recommend?
Everyone will say, I have acid reflux. I have reflux. I have heartburn. We all have it.
Yes.
Right?
Just some more than others.
Yes. And the patients that are gonna go through a bariatric procedure will develop, okay? That's something inevitable. But we have to do several tests, right? If the patient has the endoscopy and it shows changes in the esophagus, a Barrett esophagus, you cannot, it will be better to get a bypass because that will help out with acid reflux.
Okay, so it depends on the patient, basically, and not everyone has acid reflux to a degree.
I mean, yes, you're correct. Everyone will have it, but not to that point.
At all levels.
And also a big issue here is the again the habits, right? The smoking, the coffees, all the eating part that we're gonna get plays a big role because.
Can I add something to that?
Yeah. Of course.
Now that he's mentioning that, I particularly have a lot of acid reflux. I've had it before surgery and even more now after surgery. But I've noticed that changing the type of water that I drink makes a huge difference. We all know that most water has acidity to a degree. And so I've noticed that when I change to waters that are higher in pH or alkaline, I get a lot less acid reflux. And that's just me changing a small part of my diet and what I substitute my foods for. So when I go for a water that's higher in pH or alkaline, I don't get as much acid reflux as when I drink something that's a juice or something higher in acidity. So like a lemonade, Mama knows it's gonna burn.
Yeah.
But if I do like a water with high pH, like Essentia or Fiji or something to that effect, I know that that's going to give me less acid reflux. So as he says, changing your habits, your dietary habits, can make a huge difference as to how much acid reflux you get or reaction you get.
When you start cutting the weight,
Yeah.
the heartburn or the reflux will be less and less, right? Up to some. Okay, and also, even with the procedures of the full bypass or the mini bypass, you can still get the reflux. Okay, it's not gonna be.
It's not the answer to your reflux.
No, it's not.
Okay, so that'll help you guys in making your choice. If your choice on a mini bypass or a bypass is just because you want to bypass the reflux, another mom joke.
That's not gonna be the answer.
That's not the answer, and they'll be all to the acid reflux. All right, so the next question is from Angel. What are your thoughts on people repeatedly cheating on the pre-op diet? I really wonder about that. Can you really tell if someone's cheating on their pre-op? And another question that we can add in is, why are we doing a pre-op diet? And can you really possibly have to not do the surgery because the liver's too big? So all of those, all in a nutshell. Big question.
Big question, big answer, right? I mean, this is a big one because the pre-op diet is really important, right? Most, I would say almost 100%, I cannot say always 100, but 99% of the patients will have a big liver. Because when we are a little bit bigger on the outside, it's not only on the outside, it's also the inside, right? Our organ's gonna be big as well. So we can tell, yes. We know when the patient didn't do the diet.
He knows if you were naughty or nice.
Yeah.
Just because he don't look like Santa Claus, don't mean he don't know.
So please do it, right? That makes us happy. So that's also good.
And safer for you.
Yeah, that's the important part. It's always the safety part. Now the liver, it's when we are a little bit bigger on the outside, it's not only on the outside, it's also the inside of us, and the organs are going to be bigger, more delicate to work with, because as soon as we have tools to lift it up and everything, but you can easily damage it, right? And you can get bleeds, just the patient doesn't do the pre-op diet.
Yeah.
I mean,
It can cause unnecessary issues.
Riskless.
Yeah.
Also, we all know as soon as the patients did the diet or not.
Yeah.
Because the fatty tissue that they always tell us to get it out since we're there gets slimmer and really, really thin. And when they don't do it, we already know that, right? So, I mean, like I said before, it's always for your safety.
Your best interest.
This is really important. When the patients that do the diet and the patients that doesn't do the diet, that will make it longer. Put the fifth incision, put the liver tractor. It will make it feel more soreness because we have to, with the trocars, be more pressure on the abdomen.
Longer recovery.
Yeah, it's a longer recovery also. So if you just do the diet, it will help you out a lot and help us a lot also. Okay.
So let's
Please
broth
try.
it out for 2 weeks, people. A lot of chicken soup. And the good thing is you get 4 ounces the first week, okay? You get 4 ounces. So let's just try to stick to that pre-op diet just to make it easier for yourselves, you know. At the end of the day, a few months out, you're gonna feel much better and you're gonna recover a lot faster and you're gonna feel great. So what's 2 weeks, right?
Yeah, I mean, it's not something that, I need because I just want to.
You're not trying to torture us with
No,
broth
of
for 2
course
weeks.
not. Of course not.
Guys, he's not trying, the doctors, the surgeons are not trying to torture us with broth all week, okay? They're not trying to make us sick of Jell-O or applesauce or water or sipping on liquids all for 2 weeks. It's for our own good and to have less risk and to protect our livers and just to make sure that it's a more smoother procedure, guys.
This is an extra, or this is a bonus,
Ooh.
right? Because the patients, we see them, right? The first day, the first hour, they just want to kill us. Right? That's it. It is like that, and we understand that. But as the hours or the time passes by, they start to feel better and better. That's where the feelings start to change, right? Because when we get inside the room and, hey, how are you feeling? It's a question that I would say at one point someone's gonna punch me, right?
Oh.
But it is a process. It is a process. That's it. After the thoughts that the patient always tells me are, I shouldn't done this. Why did I did
The
it?
regret, right?
The regret part. That's it. It's 100% of the patient will get that.
Yeah.
But in a couple of months, they just love us, so we can deal with that, right?
Look, guys, at the end of the day, Rome wasn't built in a day, and things take time. It took us a lifetime to get to this point here to gain the weight that we did. So it's going to take a little bit of time, a little bit of effort, and a little bit of patience to get to where we need to get to, and a little bit of discomfort will be all worth it. And again, if we just follow the pre-op diet, and all these things are put in place for our safety and for a better recovery and for a better outcome. So we just follow those guidelines and stick to it and be disciplined. Well, definitely, it'll be worth it.
Yeah.
Absolutely.
There's always a reason.
Absolutely. From Kristen, if you get the sleeve and have a hernia, does the doctor automatically fix it during surgery?
Well, yes, right? It's and it's more common than you think. A lot of patients, they don't have any symptoms because they don't go hand in hand.
I have no idea.
Okay, but we have to fix the hiatal hernia.
Yeah.
We cannot do the procedure
Without fixing it.
without fixing it.
Now, I actually, behind the scenes, have Melanie here. As I mentioned earlier before, she's one of the executives for the behind the scenes and business aspect of Pompeii. So I'm going to ask Melanie a quick question because this has nothing to do with Dr. Galindo, but it was a second part of her question that I thought you can answer better.
Sure.
Can we get a hello?
Hi.
So she also wants to know if he has to fix a hiatal hernia, will there be an additional cost? And I believe it's in the paperwork, right?
It is.
You don't have to tell me what the cost is. We can always you can always ask Pompeii when you guys are coming in. But just would there be an additional cost?
It is,
Okay.
but it's one thing as a company, we took a lot of effort and thought into structure because like he mentioned, many patients have no idea they have one.
Yeah.
And the last thing we want to do is wake them up with
Yeah,
a bill.
that's right, yeah.
So if it's one of those that's big enough and it's been a confirmed diagnosis before by a previous doctor, then yes, there is a charge for it. It's $500 to fix.
Okay.
But if we get you in the surgery and you never knew you had it, it's a small repair that they can do. It's one that's necessary to complete the procedure. And just our company policy is we're not going to wake you up with a bill.
Okay.
That's not fair to you. Too many families spend the last bit of money they have to even come down here and get surgery.
Absolutely.
No one needs that. So it's a company policy. All right. We're going to take care of you, whatever it takes.
Now with the hernias, there are a lot of types of hernias, right? It's not only the hiatal hernia. The one that we have to fix, it is that one, yes, but that's only that one. The umbilical hernias, the ventral hernias, even the groin hernia, those type of hernias, the recommendation is to first lose the weight. Okay, it's always the best. And sometimes they're too big that they have to get fixed, right? But it's not something necessary that we have to do to complete the procedure.
Yeah, got you. So a hiatal hernia definitely has to be fixed before moving forward with the bariatric surgery. However, if you're a patient that knows that you have a different type, as he mentioned, one was an umbilical hernia, or any of the other ones that he mentioned, or any other ones in general, don't always necessarily have to be fixed prior to surgery or while the surgery is happening. So that's good that you brought that up. This is a personal question that I have for you.
Okay.
What are some things you might want to tell any potential or soon-to-be patient about Pompeii and yourself as a bariatric surgeon? Is there a message that you want to send out to anyone thinking of having bariatric surgery, or your fans, they want to know? Is there anything you want to let them know?
Well,
Or any suggestions you have, or anything that you've ever known in your head that you just want to kind of tell patients about bariatric surgery in general?
well, as bariatric procedures, this is a tool, okay? If I want to say something to all of the patients or your audience,
Yeah.
right? This is a tool and it is a process. It's not something that will happen magically overnight.
Mm-hmm.
You have to be really dedicated. It's not a easy way out, because I see a lot of patients that they say, no, you're just going to the easy way out. No, it's not.
No,
it's
I
a lot
can
of effort.
attest to that, people. It's not
Yeah.
easy at all. It's one of the hardest things I've ever had to do.
And it is.
But
It
one of the
is.
most rewarding at the end of the day.
At the end of the day, it's hard work and discipline, right? But that's the two words that I always use. If you decided to get surgery, go where you feel more comfortable, that you're gonna get the better help for you, and come with the best. If it is
That's
us.
right. Pompeii Surgical, Tijuana, Mexico. Let's break the stigmas, because they are amazing. But I want to just thank you again. I can't thank you enough for the time that you put forth, for the effort, for the passion, for the heart that you have, for the want to help people. It is, I want to give you the word that you like so much, to thank you. From the bottom of my heart, I have so much gratitude. Even though Dr. Galindo wasn't my particular surgeon, I still thank him because, you're one of the people who choose to want to help and change lives. And, you're a part of my family now. Pompeii is a part of my family.
Yeah, we are a family.
And it's crazy enough to say, I've had children, I've been hospitalized in the past before for other things. And I could never say that any hospital I've ever been to, any clinic I've ever been to, and even my primary care physicians, although I do appreciate all of them and everything they've done, there's nothing like how I feel coming to Pompeii. Nothing. It's a different atmosphere, it's a different environment. It was a different experience, and I can never thank you enough for just being a part of my family.
No, I mean,
So,
thank you, right? Thank you. And it's the best way to put it, I think. It's work, not feeling like work.
absolutely.
So that's the best way to get up in the morning, just clap your hands and let's do it again.
Let's have the best day possible.
Yeah, it is always like that. So thank you and for inviting me, and hopefully I answer all the questions for your audience, and feel free to ask or tell me anything at all, including you guys.
Hey. So guys, thank you so much for joining us. This was an amazing experience. Thank you again for Dr. Galindo and Pompeii for allowing me to come and be able to extend your questions to them personally and their time that they've spent with us. Don't forget to like and subscribe, because at the end of the day, Mama likes that. So if you have any other questions, guys, I will be interviewing the other two doctors hopefully soon while I stay here with Chris. And thank you for watching. I really appreciate it. Love you guys. Bye.